Okay, so I'm going to go ahead and start with some housekeeping things here. So obviously, again, hi, I'm Deborah Lee Smith. I'm the marketing director for Senergy as well as the Tennant Institute. And what we're here today to talk about is the importance of both Senergy as well as the Tennant Institute in addressing chronic disease, chronic illness, as well as addressing preventative care and what we can do in order to maintain our health, keep our voltage in a good place, keep our body in a good place. That way we can live the best life we possibly can. Just so you all know, I am both going to be talking and addressing some things and talking to Chase, as well as managing things in the chat. So if you ask a question and I don't get to it immediately, please know that it's just me. I'm just one person, and that I will have a transcript of those questions. So I will be able to address those questions in the future. Additionally, anyone who has participated today, as well as anyone on our email list, will be getting a recording of this video. It will go out sometime probably Monday next week. And so that way you can always feel free to share this if you have a family or family member or friend who you think would benefit from this, or if you want to revisit something, anything like that. We are always here for you. And so with that being said, I also am going to put in the chat if you would like to schedule an appointment with the Tennant Institute, or if you need to schedule a call with Senergy. It's really important for you to use the correct entity that you are contacting. So again, just for very basics, Senergy is the distributor of Dr. Tennant's devices. Those are the voltage devices, the microcurrent and scalar energy devices. So that is Senergy. And then Tennant Institute is where Dr. Chase is a doctor. That is Dr. Tennant's integrative health clinic. And so if you want to schedule an appointment with them, that is one link. If you want to schedule a call with Senergy, that's another link. And both of those links are now in the chat. And I will put those in the chat multiple times so that you guys can make sure that you have access to that. So without any further ado, I also wanted to say two more housekeeping things. Number one, there is a Black Friday special that is going out, that went out last night for anyone who's on our Senergy email list. And if you're not, you can go to our website and sign up. This is for $500 off of 3 of our packages, the Ruby, the Sapphire, and the Basic Plus package. This is a really great chance to get those devices if you don't have them already, and $250 off of the Diamond or the Emerald packages. If you don't know what those are, that's totally okay. That's why you can either ask us today or contact one of the Senergy advisors, and we can address that with you. At the same time, the Tennant Institute has some really incredible specials that they have going through the end of the year, and we're going to talk about those later. So both entities are doing whatever we can in order to give you all the tools to address your health and just make sure that we're kind of ending this year in the best way possible. So we always try to give you guys those tools, and that's where we're going to end that. So Dr. Chase, where I would love to start today is I'd love for you to introduce the concept of healing as voltage and how the body needs that proper nutrition, detox, and voltage to create new and healthy cells.
Awesome. Well, thank you so much, Deborah. So as far as for those of you who are new to this concept, this is going to be a repeat for those of you who are experienced, but that's okay. Repetition helps you understand these concepts. When I look at the body, I kind of look at it like a computer. If you want a computer to function, you need hardware. And we get our hardware every day in our cells as people. We get it through our food and nutrition or supplements. For a computer to function, you cannot only have hardware, but you also need voltage. You need to have it plugged in. It needs to be charged. Well, the human body, it needs voltage to be able to make new cells that work. And we can get that using some of these devices, such as the transducer BioModulator, there's multiple ways to increase voltage in your system, but the cool part with that, with the transducer biomodulator, is that it does something called correcting polarity, which you don't have to worry about the concept right now, but if you try to put a battery in upside down, it's not going to hold a charge. So the transducer uses something called scalar energy to correct the polarity, and the biomodulator charges it up. For a computer to function, you need the voltage, you need the hardware, but you also need some of the software. And I'll talk to you more about some of the principles of software today, but you can get the software through the scalar energy as well in the transducer, or things such as essential oils. And I'm going to talk to you some more detail soon about ways you can get efficient software and voltage in your system. But that's how the computer of our body works. It's constantly renewing itself. It's repairing. Our stomach repairs itself every 3 to 5 days. Our nerves repair itself every around 9 months to a lifetime. Each part of our body has different rates it regenerates at, but the big picture is that the body can regenerate, it can heal. You just got to give it the tools and resources for it to heal. And that is the nutrition, that is the voltage, and the software.
Absolutely. Thanks for starting us off on those very broad concepts, which I think is really, really important. Because I think that when people start to learn about Dr. Tennant's principles, they get it can be a lot to comprehend at once. And I think that it's just super important for everyone to remember that, like, our cells need optimal, like, building blocks in order to build new and healthy cells. And when those building blocks are not stacking on top of each other properly, that is when disease, that is when chronic illness, that is when all of these really terrible things start to happen. And sometimes we feel fine and we feel like that, like we don't get the symptoms of that for a while, because our body is able to repair and heal itself. And so it isn't until there's tons of building blocks that are not properly connected and are not correctly building cells that it really starts to decline. And then that's when these chronic illness and chronic diseases occur. So I think that it's really important for everyone to just remember those three things: nutrition, detox, voltage. That's the core right there. And then we can kind of break it down a little bit more. So one of the things that Dr. Tennant really talks about is the 5 factors. So the root causes for why we are losing voltage in the body. Because again, as you said, like, there's a lot of different ways that we can get voltage in our bodies every day. We talk about grounding, like people will talk about just exercise. Like, there's a lot of different things that we can do in order to charge ourselves up. But sometimes it's not enough. And there's reasons why it's not enough. And that's where the 5 factors comes in, where it's like there's 5 root causes of things that are constantly draining our body. So even though we are doing what we think is good in order to keep ourselves healthy and strong, those 5 factors are continually tearing us down. And just to go over those, if you want to just quickly mention what those 5 things are, and then let's tie it into what the Institute does, because that's really where you all are the key. Is like, Senergy doesn't address those 5 factors. We help you with that voltage piece. We can help you learn some different ways that the clinic will also teach you in order to help you keep track of those 5 factors and see, like, on a daily basis how those 5 factors are doing. But it's really the clinic that will step in order to help you address what's going on with those 5 factors and, get your body working make those building blocks proper again, So again, if you could just go over those 5 factors and then also talk about how the services at the Institute helps you address those things.
Okay, well, I'm gonna touch on all the subjects that are very people that they go crazy over computers, and the other one is cars, right? We're going to shift our analogy here. Our body is, everything in this world takes voltage. Computers do, so do cars. And so if you think of your body like a car, your car, when you run and use it every day, it should work and perform to its function. But everyone here has probably had a dead car battery. When you get the dead car battery, guess what? That car's not moving. And so why is that car battery not working? Is it the battery itself? Is it the wires that connect to the battery? I'm not a car expert, but there's always a reason why the car battery is not working. And so the human body is the same way. There are 5 factors we see most frequently that drop the voltage in the body and make the body sick and make it so the body cannot make new cells, new building blocks again. And they are dental infection, they are scars or tattoos, they are emotions, thyroid problems, and toxins. All these things are factors that create low voltage in the body so that the body will try to charge up, but if your body tries to make a new cell that works, a new building block, but you don't have enough voltage or one of these factors is in place, the body's not going to have enough voltage to make a new cell. And so these are the 5 factors, and these are the things that we address. And when you look at the body, there are several systems. There's a system we call our muscle battery pack system, and that's our organs. And our organs also connect to these things called fascia, which is like the power lines of our body. So that's one of the systems in our body that takes voltage. The other system that takes voltage is our nerves. The organs and the fascia are always firing voltage. It's constantly have voltage in them, but the nerves can turn on and off. So when you see us at the Institute, we are addressing those 5 factors and how they relate to body, not only it draining your voltage constantly, but also the nerves. And so let's say you're someone who you got that dead car battery and you're like, okay, I don't know why my battery of my body's not working. I need to figure out, I don't know where it's coming from. Then people will come in and they'll do what's called a package, meaning they will see multiple providers and practitioners. And so for that case, you'll always have something called an energetic exam with either Dr. Castaños or Dr. Annie, both of which are amazing providers, very, very gifted, very, very smart. And they try to find what's causing the voltage of the 5 factors, whether it's dental infection affecting you, scars or tattoos, emotions, thyroid, and they're able to work with labs to figure out how your thyroid is doing, because unfortunately in our day and age, a lot of the thyroid testing and what's considered to be normal is off. And a lot of people don't know how to calculate that. A lot of providers don't know how to calculate that, but Dr. Castaños and Dr. Annie do. And then the other factor is toxins. And so when you come in and you do a full package, you get to see one of them, depending on when you come in. And then once you figure out your sources of low voltage, a majority of them can get addressed while you're in the clinic. And if they can't get addressed in the clinic, we are going to send you what you need to do. And that's the case with dental infection to correct that. But the other person that people will see when they get when they do these packages is they will see either Felicia, who is a very, very incredible emotional release practitioner. Emotions drain our voltage because they act like magnets either to our body's fascia and organ systems or our nerves. And so when we get something traumatic in life, whether it's something physically traumatic, mentally traumatic, emotionally traumatic, there's ways you can identify where that's occurring or in your body, and you can retune that emotion to being just a memory. When you retune that emotion to being just a memory, what it does is it makes it so it's no longer a voltage drain for the body. You also will see me for toxins and structural lymphatic work. Toxins will destroy a cell as fast as you make a new cell. And so they are electron stealers. And toxins I put in several categories. There are microbial toxins such as viruses or bacteria. There's heavy metal toxins. There's chemical toxins. There's airborne toxins as well, such as allergens. So when you see me, I figure out based on your history, symptoms, and different scans, what toxicity is affecting you and how it's draining your voltage. And right there on the spot, we start the process of detoxing and eliminating these toxins from your body. And I use the scalar energy from the transducer to do it. And then I send you home. We're always about at the clinic. I have this saying, you can fish for someone, or you can teach someone how to fish. We want to teach you how to fish. You don't have to depend on us or anyone else. But we always send people home with protocols, specifically using the BioModulator transducer and other things of how you can maintain your voltage at home. And then there is obviously workup where they're going to check polarity and voltage, and also be able to check cellular voltage with some of the new devices we have here, which are really, really cool for those of you who haven't been here for a while. But the big picture is, again, you need to address the 5 factors. And not only do we look at the 5 factors, but if you think about a car and wiring in a computer, think about those computers that they first came out. They were these giant computers that first came out, and they probably weren't wired very efficiently. Well, other things we can do in the clinic is we can look at how your wiring is, and that wiring occurs through the nerves. Like I talked to you about before, voltage goes through nerves. And if your nerves are playing tug of war with each other, guess what? It's going to act like a voltage drain. And if it's a voltage drain for the body, that voltage won't go to healing different parts of the body that we want, but it goes to just maintaining everyday function. So there's cool ways we can check your wiring system for your nerves here at the clinic. One of them I do something called cranial nerve sequencing. That's where I go in and I test all your cranial nerves, and I test the motor and sensory portion to figure out where your nerves are playing tug of war with each other. I, on the spot, start to retrain it, and then I give you tools you can use at home to continue to retrain your nerves, so that way they no longer play tug of war with each other. And then another cool thing we have here, we have something called the IASIS. So the cranial nerves go through the brainstem. All neurological processes go through the brainstem, but then you also have your cortex of your brain. And so this new IASIS technology we have, what it does, it's able to check different parts of the brain to see where they're underfiring or overfiring. And you can come in and you can retrain the brain to fire correctly. So there's just these really cool things. And once you can get the voltage in your nerves to be efficient, then the voltage can go to healing. But we have flexibility here. Obviously, the best thing you can do, if you can get you can do the full package, and you can see all the providers and get all the services, then that's the best thing to do. But we understand that there are some people out there where they know, like, oh, okay, my voltage was great, but then I had this emotional trauma. And ever since this emotional trauma, my body hasn't been the same since. You can also come in and you can see individual providers without having to do the whole package. So for people that's the case, then Felicia is an amazing resource. She's incredible with emotions and trying to retune them being just memories. Don't drain your voltage anymore. And again, same with detoxing. Maybe you've been healthy, and then all of a sudden, oh man, my body wasn't the same after I had that toxic exposure. You can come in, you get detox, and you don't have to do the full package. But when you do see everyone, it helps with the big picture, and we all give you tools you can use at home that you can use. So that's one of the best things you can do, is to be able to do everything. And what's cool is that we've been able to branch out and look at specific areas. So one of the things that we've branched out into is intimacy. These last couple of years, there's been a decrease in the quality of people's intimacy, and there's a reason for it. And so we have a new package specific on intimacy and addressing voltage there, so people can enhance their quality and quantity of intimacy. And not only that, there's other packages. We know we worked with a lot of athletes. And what's cool about these packages is you don't have to be someone who's sick or injured. You can be preventative too. So we have a new sports package that people can come in and see us to help recover for sports injury. It'll also be preventative. So an example is I could give you is someone with ACL problems that like they've had surgery or something, or they want to prevent ACL tears. I know that one of the circuits that's involved is the stomach circuit. So there's things you can do, or you can address these specific things. And so intimacy in sports is one or two of them. And then another one is irritable bowel syndrome. We have a irritable bowel syndrome package, and one of the therapies that Dr. Castaños and Dr. Annie provide is something called neural therapy. Neural therapy is amazing. Again, when you're coming in to the clinic, if your battery is dead, you need a jump start. And so we're here to help you jumpstart and also help you rewire. And then when we send you home, we want to keep your battery going and keep on being healthy through things like the BioModulator transducer. And so with the irritable bowel package, one of the things they do is they do something called neural therapy, and they do it close to the sacrum, which is close to the tailbone. And neural therapy is when they inject something called procaine and bicarb. When you inject an area with procaine and bicarb, it's like injecting 400 millivolts in the area. It's an instant electron donor. And so we do that with some of these various packages, and that occurs with the irritable bowel package, as well as emotional release and other things. But also we have an anxiety and insomnia package. This time of year, it can be especially difficult. I notice that people have more anxiety during dark times of the year or winter time, which is what most people, for those of you here in the States, are experiencing right now. You see a lot more emotional challenges right now. So with this package, you get emotional release sessions, but you also can reset your adrenals. And when you reset your adrenals, that helps you better be able to handle any stress. So, again, it's not, the whole package is not for everyone. Some people just need individual, but if you have the time and the means to be able to do it, it's very, very beneficial to be able to get everyone's perspective. And it's our ultimate goal, again, to teach you how to fish. You don't have to depend on us or anyone else.
That's awesome. I always feel whenever I talk to you that I learn something new about the incredible services at the clinic, and it always blows my mind. And I think, from anyone listening, you can see that what they're doing at the clinic is really holistic as far as looking at the whole body, and it's innovative in a lot of really incredible ways. And I think that it's really important for people to remember that, again, the devices and the services at the clinic, they go hand in hand. It's not that one does not operate without the other. And so for anyone who is, questioning in the chat as far as does this work with X? Does this work with, I saw Hashimoto's, does this work with ALS? Does this work with whatever? It always goes back to the same thing, which is there's something in the body or multiple things in the body that are draining the voltage, that are causing the cells to not regenerate properly. And so the clinic can help you determine what those things are, help you figure out how you're going to address those different voltage drains in the body. And then the devices will help you after you, address those things, help you continually add voltage back into the body. I know that something that Dr. Tennant said years ago was that he wishes that he could see everyone and they would come into his office once and then address those 5 things and then have the tools that they needed in order to help heal themselves at home. And honestly, that's what you all do, is really when you see Dr. Chase, when you see any of the other doctors, they're really helping you address those 5 factors, but also giving you tools so that you know what protocol to do, how to then address those different symptoms that you're having at home. And so like, this is not traditional medicine where it's just giving you a pill and saying like, good luck, we'll see you in a month. Like, that's not what they do. And so I think that it's really important to say that, and to say that like the investment that you make in these packages, it's because it's something where like you're really going to get some really important answers about what's going on in your body. And then, you know, of course, they will recommend that you do some kind of, you know, checking up, as far as I don't know like what the frequency is, but it's not something where it's like, we'll see you again in a month, because they're, you know, really helping you all kind of address those symptoms. So just so everyone knows, I put the packages for the clinic. I'm going to put it again in the chat so you can go and check those out. And then also the specials that are going on from now until December 2nd. I'm going to put that in the, or December 22nd, excuse me. I'm going to put that in the chat as well. The December 22nd end is because the clinic will go on Christmas break at that point. So we highly recommend that you book an appointment with the clinic before December 22nd. And the final thing I'll say with all of this is that, you know, Dr. Chase touched on this a little bit, but a lot of this can be done through telemedicine. The clinic sees patients all around the world. Thousands of people all around the world have visited the clinic. And so if you are not able to travel to Texas, a huge amount of these things can be coordinated with you through telemedicine. And that includes obviously emotional release, all the stuff that, you know, a lot of the stuff that Chase does, a lot of the stuff that the other doctors do. So if you're in another country and you can't travel to the clinic, that's okay. Contact Chelsea and Michaela. They're the scheduling department at the clinic, and I'll again put their links in the chat, and then just talk to them about what you can do if you're not in Texas, because we understand it can be a lot to travel. Okay, so I wanted to say, so if someone is unsure what to do first, Chase, so let's say that they are on a real budget and they are trying to decide chicken or the egg. Should they go to the clinic first? Should they get the devices first? They really don't know which one to do. What would you recommend? And I'm going to say this is for someone who is just like sort of feeling okay. Like, we can actually do two examples here. If someone is has a severe medical condition like ALS, what would you recommend? And then if someone is just like feeling tired and has some, you know, strong anxiety and some pain and like whatever, kind of two sides of the spectrum there.
So I guess I should probably tell you, for those of you who haven't heard my story, I wouldn't be here without these principles. When I was, let's see, how old was I? I was almost 15, 16 years old. I had something called a hydrocele, which is fluid filled in the testy. It's a routine thing, but I had to have surgery on it. And after my surgery, I was given painkillers and anti-inflammatories, and those burned large ulcers in my stomach. So to try to correct that, I was given more meds. And to make a long story short, I lost 50 pounds. I went to all the best doctors across the country on paper, and none of them could help me. I was near the end, and then I heard about Dr. Tennant. And a couple days before I saw Dr. Tennant, my heart rate was only 36 beats a minute. And then the day I saw Dr. Tennant, my blood pressure was only 80/40. So it was a miracle I was alive. So I started using these protocols, and I noticed a difference within 2 weeks, and I was completely better after being sick and almost dying for 2 years. So if there's hope for me, there's hope for anyone. Now, when I was so sick, I absolutely had to have the BioModulator, and that's one of the keys that got me better. I wore it all day, every day, and it got me through the school day so I could get through school. And slowly but surely, my body healed. And it's not an overnight process. Again, different tissues have different regeneration rates. But for me, I needed more. So if you are suffering from something that's a harder chronic disease, such as what I went through, or ALS, Yeah, absolutely. If you can do both the package and the devices, it's going to be absolutely necessary. Maybe you're someone who's like, I don't have anything that comes to mind. I like, there's nothing that triggered me that I just want to be well. Maybe all you need is the packages or the devices. You know, the good news is you can always schedule a Calendly with one of our front office people, Chelsea or Michaela. They're amazing. They'll tell you, they can steer you whatever direction you feel like you need to. If you're on a budget, maybe they'll say, well, maybe you only need a detox. Maybe you only need structural work. Maybe you only need emotional work. Or they'll be able to tell you what you need, and they'll point you in the right direction. But again, the amazing thing with the devices is they can help everyone and anyone, both help the body get better, but also be preventative. So just go with your gut instinct and use our resources at the resources at Senergy and here at the Institute, and they'll tell you what you need.
Yeah, awesome. So, something that I think is really important that someone mentioned in the chat is that it's not just for if you are super sick. Like that's something that I think that we all are going through our lives thinking that we're really healthy and that we're fine and like whatever, and then something hits us and then suddenly we're sick. And I think that it's again what I mentioned before, where it's like we've got all these little building blocks, like all these little cells that are making up our healthy body, and our body can seem to be doing really, really great, and it's only until one of them gets pulled down at the bottom and everything crashes down that we then go to see the doctor. And so it's really important to start making sure that those building blocks are healthy and are doing what they are supposed to do in order to maintain our health on a daily basis. I think that that's really key. And that's where the devices can be really beneficial because, again, these devices are at-home devices, Dr. Tennant's devices that he used or that he developed in order to help heal himself and in order to help thousands of people around the world. These devices are meant to be your at-home tool to help you constantly both recharge your cells, but then also to address pain, inflammation. Like there's so many different things that these devices can do. And so with that, I just wanted to give two quick resources. So number one, the Tennant Institute and Senergy hold an integrative health conference multiple times a year. This integrative health conference is a really incredible way to get insight into both the devices as well as the 5 factors, as well as everything that the clinic does. It's really, really important. And our next one and the last one of the year is December 7th through 9th. So I'm going to drop that link in the chat, and we'd strongly encourage, if you haven't attended a health conference, to please come. If you are a device owner and you have a ticket available, then it is free, because with every device purchase, you get a free ticket to this conference. If you are not a device owner, then it's $450. That is a 3-day conference, and it's groundbreaking. Like what you learn at these conferences is everything that we're talking about here, but in minute ways, and it really will blow your mind. So we strongly encourage you to sign up for that. And then the other thing that I'll say is that again, both the Michaela and Chelsea are really the perfect way for you to talk to them and be like, this is what's going on with me. What would you recommend we do? Like, it is a holistic way at like looking at your medical history, and then they can help advise you. Similarly, like Senergy is really focused on educating you and empowering you to take your health into your own hands. And that's why with Senergy, we have monthly device owner Zooms where you can learn about different ways to use their devices. We have guests, we have all those things. We have a very extensive education center where you can learn about different protocols and how to use the devices. And so I just want to emphasize that like we are here to support you all on your health journey. Wherever you're at, both the clinic and Senergy is really here to like help you along this journey. So please don't lose hope or don't think that you're going at this alone, because you're not. Like everyone here truly cares because we believe in what Dr. Tennant does, what Dr. Chase does, what everyone does. And so we're just here to help you all. Okay, so the next thing that I would like to address really quickly is the final thing that I actually wanted to address is the daily protocol. And so that's something that, so the daily protocol is a step-by-step protocol that Dr. Tennant has developed that is kind of the baseline for where you start when you want to recharge your cells. And it is both addressing different circuitry in your body in order to make sure that different meridians, that different circuits are turned on in the correct way, and to take your body out of fight or flight, to make sure that your polarities are turned on. Like, it's a multiple step protocol that should be done as like if you have a question, if you have a pain, if you have a whatever, we always say you start with a daily protocol and then you can address that issue with the transducer or whatever. I would love to hear a little bit about what obviously, like, that's the baseline, that's the daily protocol that at Senergy we always recommend that people start with that. How does that differ from the protocols that are recommended with the clinic, or how do you all add to that? So what is the benefit if someone comes in and they've got, you know, a specific pain in a specific area and you've determined that it is caused by whatever? Like, what protocols do you all add to that?
Wow, what's cool is that obviously, yeah, the daily protocol is all encompassing and it helps raise voltage in the entire body. But there's times where we can accelerate the healing process if we are able to focus the voltage on a specific area. So some of the things that we have here in the clinic are both in person, and also there's some tools we can give you through telemed. There's ways we can show you how you can use the BioModulator transducer other than the daily protocol. Like for people I have who have, for my people who've had head traumas, or like football, hockey, rugby players, there's a way you can keep the brain firing properly using the BioModulator Pro and the transducer. There are, no matter what you're coming in with, if you need a little extra emphasis on a certain area or you're suffering from something certain, we can give you specific protocols using the BioModulator transducer that other people may not know about, but other people may not need. It might just be you that needs it.
Awesome. Okay, great. So we've got about 20 minutes left for questions. We had some really, really incredible questions that everyone submitted before the Zoom. So thank you everyone for submitting some questions. And I'm going to pull out some of those questions. Again, if your question does not get answered, you can either respond to one of our, when I send out the emails from Senergy, you're welcome to respond to that if you would like to, you know, get some more advice or, you know, whatever. Again, we will probably tell you to make an appointment with an advisor at Senergy or with Chelsea or Michaela at the Tennant Institute, because they, like, that staff is so impeccable at helping you look at what's going on in your body and helping you figure out your next best steps. So just so you know, with a lot of the questions that we got, we're going to say, hey, wonderful question. This is who you should reach out to in order to get those questions answered. In the meantime, I would love to say, actually, so one person asked in the chat, and let's start with this while I look through the other ones. What cannot be done through telemedicine?
What cannot be done through telemedicine? We won't be able to check polarity, which is, let's go back to the battery analogy. Our body is a stack of batteries, okay? And so it's well known in battery physics that when the voltage of a battery drops to 0, this flips upside down. And when this flips upside down, you cannot hold a charge. So through a telemedicine visit, we cannot check your polarity. You have to be in person for that. But we can, based on your history and symptoms, we can usually pinpoint where the low voltage is occurring and which circuit it's in based on your history and what we've seen before. So an example is people with macula problems in the eye usually have low voltage in the stomach circuit. And so it's different for different diseases, conditions. So we can't check polarity. The other thing I can't do any structural lymphatic work over Zoom. But I can do toxins. People can send in hair and nail samples. I can see which toxins are electron stealers for your body, and I can send you reverse frequencies or remedy frequencies of a bottle you can take orally or use your transducer probe to drive it in your system, the scalar energy from it. I can also do cranial nerve work, and Felicia, our emotional release practitioner, can do emotional work over telemed. And then again, Dr. Annie and Dr. Castaños are amazing. They can still do a general assessment through Zoom. We just can't check polarity.
Yeah, and one thing to note is that obviously checking the polarity, of course, is important, but if you have a transducer, you can flip the polarity of the body anyways. So like, I don't personally check my polarity every day, but I will just use my transducer in order to make sure my polarity is correct. So that's one thing that like we always recommend. If you're going to do a telemedicine appointment, we would strongly encourage you to have the devices, because then you can talk to the doctors and they can tell you exactly how you can use the devices in order to correct those polarities and all of those sorts of things. So we've got a couple questions about like, you know, how does one use the transducer with the detox formula, all of those things. Let's just say that Chase takes an extensive amount of time with every patient, as does all of the doctors, in order to make sure that you are getting, you know exactly what to do. So like there's never going to be a time where you leave an appointment with the Tennant Institute and you're confused as far as like what to do with your detox frequency, what are the next steps, anything like that. So with any questions as far as like, what do I do X, I will just say that like, once you have the appointment with Dr. Chase or with one of the other doctors, they will help you determine next steps, how to use the devices and all of those sorts of things. And then again with Senergy, same thing. Like we really pride ourselves on our education, on our customer service. So like once you purchase a device, and before you purchase a device, you can always talk to an advisor, and they can help you, you know, figure out the daily protocol, figure out, you know, what you should do and how you should use the devices, all those sorts of things. And so it's really just know that, again, we're here to support you and we're here to like, you know, help walking through all of those sorts of things. One question that someone asked that I think is valuable, because COVID is starting to rise again. And so someone asked if they just got COVID, how can they support their body healing with COVID?
So any virus or bacteria, it can be latent or active in the system. So an example is chickenpox. When you've had chickenpox, that's the herpes 3 virus. And when you get chickenpox when you're younger, a lot of people get it when they're younger, you get those red dots everywhere. When you get those red dots everywhere, you're contagious and you have symptoms, it's active. And in that state, they are the most electron stealer, meaning they steal voltage from your body. But what happens is your immune system fights it. When it fights it, these viruses or bacteria go from active to latent. When they go from active to latent, they need to hide out from your body's immune system, and they find a weak part of your body and they kind of go and chip away at it. And then later in life, when your voltage or oxygen drop enough, that's when these viruses or bacteria say, okay, time to come back out and have lunch on this person. So people who've had chickenpox before, later in life will get shingles, which is very, very painful. That's that same virus going from latent, which can steal electrons from you, but not as much. But when it's active, it's more of an electron stealer. It's going from latent to active. And so with COVID, it can be latent or active in the system. But the good news is these viruses or bacteria cannot thrive when you have high voltage, high alkalinity, and high oxygen. And that's one of the things that we try to teach people too at the clinic is when I do cranial nerve work, I try to see how people's nerves are doing, because it also tells me a story about their breathing pattern. So if you have enough voltage, oxygen, and alkalinity in your system, these viruses or bacteria cannot live in your body. And so specifically for COVID, what I see recently, there's a cool way. Let's teach y'all a gem here today. Last year, I noticed that when people got COVID, it really affected their lower large intestine, in the lower left abdomen, and kind of upper right abdominal quadrant. So one thing that's great I like to do is, this helps your lymphatic system and your gut motility, is I take the BioModulator and I put it in 10-8 mode, and I put it on my abdomen, and I turn it up on my skin. I turn it up till I barely feel it, and I go clockwise. When you do that, you go the direction of digestion, and it helps with some of the gut motility. When the colon doesn't have enough voltage in it, then that's when something like COVID could thrive. And that's also why it gets in people's lungs. So that's like a really cool trick you can do. If you either had it or had it previously, 10-8 mode, turn it up till you barely feel it, and just go clockwise, even for a couple of minutes, 3 to 5 minutes. It's all it takes. And that really helps your gut motility for COVID, what I see specifically. But you also need the large lung circuit firing. So there's ways you can use the patches which connect to the BioModulator to boost that circuit, and also the transducer. But again, it's not something we should have to fear. Anything can be overcome. Just need the voltage to do it, and the oxygen.
Wonderful. Elaine, I see your hand, and I'll get to you in just 1 second, just because I want to tie this also to Lyme disease, because that's another thing that we get asked a lot about. So if you could address Lyme disease as well, and how you'd go about addressing that.
Lyme disease, almost every single Lyme case I see, there's dental infection. That's one of them. The second one is emotions. This might be, for those of you who are new to these concepts, this might be something that's like overwhelming. I don't want to overwhelm you, but certain emotions will resonate with certain toxins in the body. With Lyme, I see that Lyme can thrive with fear. And so if you have a chronic Lyme, you need to make sure you raise the voltage in the first place, because Dr. Tennant's talked about it in previous videos. Of those of you who've seen it, Lyme bugs will come out when the voltage and the oxygen drop. Mm-hmm. But secondly, if you have dental infection, that's what I call like a nest egg for Lyme. And then if you have emotions that are attracting the Lyme in you, you need to get all those factors addressed. But raise the voltage, get the dental infection addressed, and the emotions, and also detox it too. I have reverse frequencies for Lyme as well, but we're all about getting to root causes, and that's always what I want for you. I don't want you to have to depend on me or anyone else. I want to empower you. Wonderful.
Okay, Elaine, go ahead and unmute yourself and ask your question.
Hey, thank you so much. I'm relatively new to Senergy and these concepts. I purchased the Diamond package in January, and it's been phenomenal for me. And I'm a physical therapist, and I've slowly been incorporating it into my clinic. And I don't want to get excited for about a year, but we're coming up on a year. So I've just been very, very impressed. But excuse me, my specific question is to Dr. Faldmo. In the education center, somewhere there you are lecturing, because the doing like pendulum, that can be kind of foreign to some of my patients. So you went over there with a patient demo. He was wearing a white shirt. I can't find that video where you could test like abduction was the sympathetic system, parasympathetic. Is there some way you can put that in the chat Where, because I can't find that video.
I would probably be able to find that for you, Elaine.
Okay.
Because I think that's a clip from one of the integrative health conferences.
Yeah.
That's my guess, and so I can make sure to send that to you.
Okay.
Chase, you want to add
Awesome.
anything?
Yeah, no, yeah. Let's have Deborah help you find that. But I agree. I wish I had access to that. I don't. I've given so many presentations, I didn't record them. So I know
Okay.
Senergy has it somewhere they could get it to you. But I agree with you. In some cases, when patients physically feel the test, they feel the muscle weakening or pain. That's just as good, because that's just as good or even better. The pendulum works too, but some people, this is all completely new concepts.
Right.
And what we try to do here, we're trying to bridge that gap between Eastern and Western medicine. And that's
Yeah.
what's so beautiful about these principles. So
I
that-
love it. Thank you. Yeah, I can't believe what I've seen with my lupus symptoms. My husband did get shingles, and Carla was just tremendous with helping a daily protocol, as well as a specific kind of shingles protocol. And in 5 days, now results are going to be different for everyone, but his blisters just nearly reversed. His doctors couldn't believe it. So I've got a lot to learn. So thank you so much.
Wonderful. Thank you. I'm just gonna move your spotlight there. Yeah, thank you so much, Elaine. If anyone, we've got about 5 more minutes, and I just want to highlight a couple things here. So number one, if you're a practitioner and you're using the device in your clinic, we've had some questions about how to go about, getting support or to become an affiliate, as far as like if you have patients who want to purchase these devices, again, they're at-home devices. So this is something that like you could help your patient learn how to use it themselves. So you can contact Senergy. We have a really wonderful affiliate program. So that way, like, you can get a little bit of a thank you for passing it on. We're just really focused on making sure that everyone knows about this technology and knows about the incredible work that Dr. Tennant does, and that all of the doctors at the Institute, do. Like, we just really want to spread this as much as possible. And it's just like word of mouth is key for us. So we just want to thank everyone who has, there goes my light, who wants to say wonderful things to us. We really, really appreciate it. So thank you for what you're doing. And then Chase, final thing, while I'm going to turn off this light that's freaking out. Can you please address brain sequencing and what you do with that? And, how someone who has brain fog or different brain conditions, how you can assist with that?
So what's cool is if you do ever come in person, I can do something called a proprioception test. Your brain is one of the things that tells your body where it is in space. And so there's this finger to nose test where I can test something called your cerebellum and also the frontal lobe of the brain. And if your brain doesn't know where your body is in space, then it tells us that lobe's not functioning. And so you can use frequencies from the transducer and you can use the frequencies from the BioModulator Pro. There's brain waves in there, and you can use the transducer and you can drive in the brain waves into the brain to help recalibrate it. And what's amazing is when I've been able to do these checks in person, I've done it to people who were they are able to know where their brain and where their finger was able to touch your finger after touching their nose after. It completely changes the test, which is amazing because this is not only applicable to everyday life, but it's also for posture. This helps. This is also great for athletes. Since Thanksgiving's coming up, a lot of people might be throwing the football. If an athlete if their brain doesn't know where their body is in space, they might think they're throwing one direction, but they're not. So you can use the frequencies from the BioModulator to drive it in the brain. And so one thing I do is the brain is kind of like a stick shift car. Each lobe of the brain is like a different gear. So you can run these brain frequencies in a certain order to either drive up the brain to help it get more energy, or in some cases, there's some people where their brain is overactive and they can't calm it down for like nighttime, specifically for sleep. So there's a way you can go in certain order and calm it down using the BioModulator Pro and Transducer. So it's really cool. I've done it to people who've been able to move their arms, but also it's amazing is you can test someone who's unable to move their arms through someone else by connecting to them, their brain, and then you only treat the person that they're unable to move their arms, and you retest, and that person is able to get it 3 for 3 spot on, which is incredible. I've done it to people who are unconscious too, and it works great. So just amazing technology. The BioModulator Transducer, the scalar energies, it's the real deal. It can penetrate through bone, and so get right there in the brain. Very, very powerful.
Awesome. Someone just asked a follow-up question. Is it long lasting, the brain recalibration?
For some people it is. Now, there are certain things that make it so it doesn't always last as long. I'm a football guy. I played a lot of football. So for people, if they have repeated head traumas, then you might have to repeat that more often. But if you're not one of those cases, or maybe if you're someone who has PTSD and you get triggers and you haven't addressed any of those triggers, then sometimes you have to repeat it. But for some people, they only need it once and it lasts. Knock on wood. Let's hope that's you. But if you need repeat treatments of it, that's okay. The good news is you can use these devices on your own to treat yourself repeatedly for those who get who need repeat treatment.
Wonderful. Thank you so much, Dr. Chase. I really, really appreciate you being here, and everyone for participating in this. Again, just some like ending housekeeping things. We've got the Integrative Health Conference coming up in December 7th through 9th. That's a really wonderful way to get more in depth into all of these different concepts that we're discussing. And you'll be able to, meet Dr. Chase and talk to him. And that's in person in Texas, in Irving. The link is in the chat, and I will put that in there again. And yes, someone has just said you can obviously come early or stay after the conference in order to get appointments for the clinic. So you could, just come to Irving once in order to, see the doctors, do the Integrative Health Conference, or do the Integrative Health Conference and then stay afterwards. We're really just here to support you as much as possible. The Black Friday special runs from now until the 27th for Senergy, and that is $500 off the basic, the Ruby or the Sapphire package. Those are all the packages that have the basic plus biomodulator, and then $250 off of the Diamond or the Emerald, which are 2 packages that have the biomodulator Pro. If you don't know what I'm talking about, when I'm talking about the Plus and the Pro and all of those sorts of things, there is an extensive education center where we can direct you, even if you are not a device owner, and that can help you explain all of these devices. Also, obviously, our the 27th of November is when the Black Friday sale ends. So it starts today and it runs for 11 days. So it's just Black Friday, but we're doing it for about a week and a half to give you all, lots of time in order to contact our office, speak to an advisor, and they can help you figure out which package is best for you, because we understand that it's an investment in your health. I also want to say, for anyone who is a device owner who is listening, this is something that people don't know about, and we want to make sure that we continue to emphasize this. If you're a device owner and you want to get a second device, either to use it for your husband, or because we have multiple ways that you can use multiple devices in order to speed up the healing or to, speed up the daily protocol. Second devices, we have a big discount for that. And if you want to upgrade from a Plus to a Pro, there's a big discount for that as well. So you can always ask our advisors about those 2 programs. Again, the Tennant Institute has their specials that they're offering for their packages, and that I've also put in the chat. The specials at the clinic are going to run until December 22nd, and then all services at the clinic are also on the website, and I will put that in there as well. And so we really recommend that you take advantage of these specials while we have them. And again, that'll run through December 22nd, because then the clinic is closed for Christmas. Chase, is there anything else you want to add?
No, I know that we have the masters tomorrow.
Yes.
So for those of you who I don't know if the masters is full or not, but the brain frequency thing I was just talking about, I'm gonna show you how you can actually do that finger to nose test and correct using the BioModulator Pro and Transducer. I'll show you that tomorrow.
Yeah, thank you for reminding me about that, Chase. So anyone who is a device owner and has attended an integrative health conference, you can attend the master conference, which is starting tomorrow. It is Friday and Saturday. It is $600. That does not, like, your device ticket does not apply to that. It's a special class. It's an advanced level class for anyone who wants to dive in deeper into all of these things. And so I'll put the link right now in the chat as far as how to sign up for that. And then the final thing that I'll just say is that anyone who just joined, we will be sending a recording to everyone on Monday, probably, of this conversation. And again, you can always reach out to us if you have any further questions. And please feel free to take this recording, send it to a friend or a family member that you think might benefit from learning about this. Again, like, word of mouth is key for us, and we really appreciate everyone's testimonials and support and love and everything. And if you have a testimony you want to share, reach out to me, and I would love to record it and share it with everyone, because again, it really helps. So I'm going to put my email address right now in the chat as well, and so you can always reach out to me and I can help you with next steps. I think that's it. Thank you again, everyone, so much for joining us. If this was beneficial for you, let me know. Again, you can email me, and we would love to do this again. We'd love to do this with Felicia Garrett, who's the emotional healing practitioner and really, really incredible. And so I just appreciate everyone being here and learning more about how the clinic and Senergy are this like copacetic relationship, and it's really important to look at both of those in order to be on your healing journey. So thank you, everyone. I hope everyone has a wonderful Thanksgiving, and we'll connect with everyone again soon.